Welcome to Meet the Docs with your host, Grant Otten, brought to you by Columbus Community Hospital.
Welcome to another edition of Meet the Docs, sponsored by the Columbus Community Hospital. I'm your host, Grant Otten from News Channel Nebraska, and I'm joined by Dr. Lodhia today. Doctor, how are you doing?
Good, thank you very much.
Well, I guess just to start off, can we talk a little bit about what it is you do?
Yes, I'm a neurosurgeon and a spine specialist. Did a fellowship in spine and do mostly minimally invasive spine as well as complex spine. And been doing that for 10 years and in the Columbus area for several years now.
Cool. Well, how do you get into that field? When did you decide that that was what you wanted to do?
Well, initially I knew I was going to do surgery of some sort, and I was just fascinated with the brain and being able to operate on the brain, and that watching a few surgeries like that was quite impressive to me. So that kind of pushed me in that way. And then as I started training, I started to appreciate the spine and the structure and the kind of construction and engineering aspect of it, that there's a mechanical aspect, and my partial engineering background kind of appreciated that.
So is there a lot of additional work that you have to do when you're really looking at the brain? Because that's obviously a very complex part of the human body.
Typically you go through 4 years of medical school after undergraduate or other training, and then an additional 7 to 8 years residency training and possibly fellowship if you subspecialize beyond that.
Cool. Well, can we talk a little bit about that educational journey that you took, I guess, to get to this point?
Yeah. So I ended up first starting out in engineering and decided that wasn't for me. I was in aerospace engineering at Iowa State, and then switched over to Lincoln and started to do biology, and then going pre-med route after kind of realizing that I was probably better off in more of the biological and life sciences. And a lot of my family was in medicine. I never thought about it at the time, but it just seemed very natural, and I was good at that, and I appreciated the classes and the coursework I was taking. So I did go to medical school then, applied to medical school, but prior to that, I also was working as a histology technologist in one of the hospitals in Iowa, and was doing my master's degree. And so I finished my master's degree in molecular biology at University of Nebraska as well. Following that, went to school at UNMC for 4 years, and then subsequent went to University of Michigan.
Okay, very cool.
So did my 7 years of training there and fellowship in spine.
Awesome. Well, this building is obviously new, and so operating out of this new visiting physicians clinics, what's that been like for you?
Oh, it's been great. These facilities are fantastic. There's a lot of room. Very spacious, nice new car smell. So, no, it's been very nice because we've been here during that transition period, and it's nice being next to some of the other specialists, like some of the chiropractors here, so we can kind of talk about patients that we may share in common.
And obviously, spine and brain stuff again can be very complex. But why would somebody, I guess, need to come see you?
Typically, someone would come to see me at a referral of one of their doctors. Generally, it would have something to do with they usually have back and leg pain or arm and neck pain. Those are the typical things that we will see. And typically they would have a study, either a CAT scan or an MRI scan or something similar, that would show an abnormality. And they would have failed conservative treatment, usually physical therapy or some other form of treatment.
And when you talk about doing surgery and these different type of aspects, I guess, what are some of the stuff that you can do as far as surgery goes? Yeah,
that's a good question. The surgery is obviously a limited component to back, neck pain, arm, and leg pain. We limit ourselves to something that we can restore that's unstable or broken, or something that is compressed and we can take pressure off of, because that's essentially what we can do. We can also remove things like tumors that might be causing instability or pressure on the nerves or the spinal cord. So those are the kind of problems we're looking for, more structural problems that we can fix.
Oh, and just kind of continuing with that, do you do surgery very often, or is that something that it's just kind of every once in a while, or depends on the patients that you receive, I guess?
As a whole, my week consists generally of about half surgery and half clinic. About 2.5 days of each of those is what I do. In terms of what I see in Columbus, I would say the majority is being evaluated for if they need surgery, but I would say certainly more than half or the majority do not need surgery and can get by with some conservative treatment or just do not have a good surgical indication. But A fair number do come with a very good surgical indication and have failed treatment or may fail later if we send them to that, and they would make generally good candidates for surgery.
So I guess talk a little bit about what is your subspecialty then?
Yeah, so as a neurosurgeon, we deal with the entire nervous system, peripheral nerve, brain, and spinal cord, and many of us subspecialize. And myself, I've subspecialized in spine, did a spinal fellowship with orthopedics as well as in neurosurgery. And my area of subspecialty is the complex spine, but particularly minimally invasive spine. And what that means is doing the surgery through smaller or less invasive means.
And what kind of stuff do you fix with that? I guess I'm sure most people are maybe curious
Yeah, so
about.
once again, it's doing some of the same surgeries but through different approaches, and that may include fusions, meaning to stabilize the spine and to get the bones to heal together if there's a fracture or a slip or an unstable segment. Or we can do laminectomies and decompress the spine, take away bone and bone spurs and things that are pinching a nerve. We can oftentimes do that through an endoscopic tubular route, a more minimally invasive route. And many of these patients can go home outpatient. Other surgeries like fusions sometimes can be done as well, minimally invasive, and limit the blood loss. Recovery time's a little faster as well. So there's some benefits to those approaches, I believe.
Well, Dr. Lodhia, thank you for joining me. I appreciate it.
Thank you. Appreciate it. Thank you.
Well, thank you guys also for tuning in for another edition of Meet the Docs. I've been your host, Grant Otten. We'll see you next time.